Broadcasting from the studios of AM 950 KTNF, the progressive voice of Minnesota. Welcome to the Gailey Show. I am your host, John Parker. There is a lot happening in the headlines every day, almost all the hours of the day, but this is our time of the week for our Thinking Clearly, Thinking Queerly episodes, where we sit down with a single guest for the majority of the episode to help us think more clearly and more queerly on the major issues of the day facing the queer and allied community. After that, I'll continue my Queer and the Cosmos essay series. To catch up on today's headlines, I do invite you to stay with us here on AM 950 for the Matt McNeil Show, which starts at 3 p.m., and after that, Native Roots Radio, which starts at 5 p.m. My guest today is Ezra McNair. Ezra is the advocacy organizer and volunteer manager for the Aliveness Project here in Minnesota. Founded in 1985, the Aliveness Project supports people living with and at the greatest risk of HIV through transformative resources and direct services. These services include food and nutrition support, case management and housing help, PrEP, PEP, HIV testing, and support groups. Ezra, welcome to the Gailey Show.
Thank you so much for having me, John.
Right. So, speaking of headlines, the Trump administration, Elon Musk, basically MAGA world, has really gone after HIV funding programs and are now closing, well, at least according to the Washington Blade last Tuesday, a series of mass layoffs targeting, staff, departments, whole agencies began within the U.S. Department of Health and Human Services under everyone's favorite Secretary, RFK Jr.
Yep.
With plans at 10,000 jobs is what they're planning on cutting. I was reading in a press release, also cited in the Washington Blade, the HIV plus Hepatitis Policy Institute, saying the Trump administration just eliminated the staff of several CDC HIV prevention offices, including whole offices conducting public health communication campaigns, modeling and behavioral surveillance, capacity building, and non-lab research. Ezra, my first question to you, what is the impact of that on a local level? Like we can see the headlines of that. We can read the national stories and understand, ooh, that doesn't sound great. What does that actually look like on the ground in a city like Minneapolis, in a state like Minnesota?
Yeah, so in Minnesota, we still have a really prevalent HIV community. I think maybe the thoughts of the folks at the thoughts of RFK or the thoughts in the Trump administration are that maybe HIV is a bygone illness, that maybe they incorrectly think that transmission rates are down or something like that. All of the data that we see at a local level suggests otherwise. So in Hennepin County, there's been an ongoing HIV epidemic actually for a handful of years. So we've been seeing transmissions going up from last year to this year, from 2023 to 2024, transmissions rose by 24% in Minnesota. And that's really, really not good, So that means that there's more people that are living with HIV and could potentially transmit HIV to other people. So just on the local level, we're still, we're seeing those numbers. But then, with preventative care and prevention services, what's really tough is the folks that are most impacted by HIV are people who are of lower classes, poor and working class people, Black folks, Indigenous folks, and then especially in Greater Minnesota. I had some time last week to spend with someone who works with the Indigenous Peoples Task Force, and they do a lot of work on reservations, and even on reservations, there isn't a lot, accessible public health care. And in HIV, one of the main things that we use for prevention, one of our main tools for prevention is a medication called PrEP. There's a couple different versions of PrEP, but PrEP stops someone, PrEP prevents someone from being able to transmit HIV or pass it on to anyone else. So it's a really, really key thing for people that are living at risk, at a higher risk of HIV, that they have access to PrEP, and that PrEP is free too. And then the other thing, and some of those programs and staff that were impacted and cut from the CDC, they worked on a lot of the national messaging and the distribution of grants to communities like mine, where we're the trusted messengers. So we were able to tailor marketing, tailor PrEP advertising to our communities, because otherwise, you can have a really, really wonderful community center. You can have a great hospital system. people don't like going to those places willingly. You know what I'm saying? That's like, there's levels of trust that folks have. So you need to be able to go into communities, meet people where they're at, whether that's churches, community centers, public events, and, educate people on sexual health care, educate them on PrEP, let them know that it's available and it's for free. With these kind of cuts that are happening and again, Doge has been all about cutting unessential, what they see as unessential services. So that falls into a lot of prevention. People won't get the medication that they need if we don't have all of the social services that actually get people in the door. You got to build relationships, you got to build trust with people. And if you're firing all the folks that we're thinking about how to do that intentionally for communities, then the same people, we're going to have the same issues that we've had for the past 20 years, which the communities that need PrEP and prevention services the most don't have them. There's around 1.2 million people in the United States living with HIV, but only 13% of them are actually getting the care that they need. So that's really, really not good, and in Indigenous and Black populations, those numbers are a lot higher and more prevalent. So yeah, we need kind of that the consistency of being able to, be in the community, be boots on the ground, and have those, have tough conversations with people. People, what do I need to get on PrEP? HIV doesn't affect people like me. And it's oh no, you're at a high risk because you engage in XYZ behavior, which can be a whole lot, plenty of things. So it's not necessarily just locked into someone's sexual health care or something like that. It can be, people who use intravenous drugs, or people who are in precarious situations, like they're sleeping outside or something like that. They're all at a higher risk. So
it's interesting because in the first administration, they actually had a plan that it was a end HIV by 2030 or something. So This is a complete reversal, which is basically, I don't know. I don't want to speculate because who can figure out what they're doing over there? I think one thing that I do want to ask you about. So if we have an epidemic here in Minneapolis, is that specific to the cities, or are we seeing this in other metropolitan regions as well?
Definitely seeing this in other metropolitan regions. The rate of transmission is oftentimes higher in a densely packed urban area. However, in greater Minnesota, in like I mentioned, reservations, or just even in rural Minnesota, where there's just physically less access to medical care, there aren't public health services that you can go, you can just go outside and find essentially. We also see higher rates of transmission in those counties as well. So it really depends on in the cities. It's more the challenge is more based in outreach. There's a lot of resources in the city right now. There's a lot of resources in the cities. So the challenge is outreach, but in rural areas, the challenge is more access, getting people physically into a clinic or getting them their medication, whether that has to be mailed to them or someone has to drive it out to them or something like that. That's more of the challenge.
I think that there's something to the idea that the quilt, they don't see the quilt on the National Mall anymore. There aren't all of the headlines. And so I do think that there is, for the general public, maybe this idea that, is HIV still a thing? Can you talk, so you mentioned a number of over 1 million people are living with HIV right now, but only, what was it, you said 13% were getting the care that they needed. What are the barriers there that are organizations like you trying specifically to try to address? You were talking about communication being one of them, going to the places where they need to be, but is it a question of people just not, I don't know, can you help me characterize that?
So there's a couple ways I can go about this. The first way is to kind of answer the first part of your question. Do people understand the state of the epidemic right now? As a young person, I'm 26. I, went through high school and college in the 2010s. And I'll be honest with you, coming out of that education, I didn't receive a lot of formalized, intentional, anything about this is the HIV epidemic. This is how it affects a bunch of different communities. And here's this part of our history, So it was only when I started to get into public health and get into this field where I started to realize what the scope of it was. So as a personal vendetta against HIV, I have done a lot of educating and talking to my community, other young Black folks, other young queer people, just about what HIV is and what a big impact it had on, our elders, our queer elders. There was a time when we would, probably in 2017, where someone said to me, how come there are no older gay men that I can talk to for advice and stuff like that? And we were like, oh, who knows, and you find out, so many people lost their lives during the initial HIV epidemic in this country that really, has taken a key piece away from, young folks' understanding of our queer history. So that's kind of the first piece of it. And then barriers that Aliveness is working to eliminate all kind of rest in other, not necessarily, well, yeah, actually, I would say all of these things are healthcare related, but, we have housing services. We've had a meals program that's I think been going on the longest out of all of our programs at Aliveness, which is we have serve one hot meal a day. Folks can take 2 to-go meals. So, we're really trying to provide, kind of a, if you look at someone as oh, you're just a person living with HIV, we need to get you medication and you'll be okay. That's not necessarily the case for a lot of people. It's more they're a person living with HIV and they need housing support. They also need stable meals. They need case management. So they have someone that can help them navigate all of the, some of these government programs that still exist and still function aren't easy to get into, aren't easy to qualify for. And certainly the government isn't running around saying, oh yeah, the Ryan Wright program, if you're living with HIV, you can have your medication paid for. That is not public health messaging that is happening from certainly the federal government. Some states are better at it. Minnesota is definitely better at working with state partners. Our DHS is really, really great at, providing data and trainings and things like that. And I'll get to DHS in a little bit here, but, so we kind of see a person, not just as someone living with HIV, but as a person who has, all these needs that need to be taken care of.
So much still to get to here with Ezra. I've got to fit in a commercial break. Please, folks, connect with the sponsors and advertisers in this break, because they make conversations like this possible. Tell them that you heard about them on The Gailey Show right here on AM 950. Also, follow us on Blue Sky for more progressive news and analysis. We're at thegaileyshow.org on Blue Sky. Welcome back to The Gailey Show. It is 21 minutes past the hour. I am your host, John Parker. It is our weekly Thinking Clearly, Thinking Queerly episode. My guest is Ezra McNair. Ezra is the advocacy organizer and volunteer manager for the Aliveness Project in Minnesota. The Aliveness Project was founded in 1985 by a group of community members living with HIV who wanted to celebrate simply being alive. They gathered with their loved ones for potlucks where they could unite over food and foster healing in those devastating early days of the HIV epidemic. Ezra, you're talking about coming of age in the 2010s, not having a lot of education. Even though I don't look it, hit puberty in the late 80s. So there was a conspiracy of silence then as well, where they didn't want to talk about it. So it's sad to me to hear that even in the 2010s, and I'm sure happening now, there's still this conspiracy of silence going on, where they're not providing the education still to this day. And now we're just seeing the administration going right back to where we were in the 80s, which is no funding, no anything. Good luck, you're on your own.
Mm-hmm. Mm-hmm. It's and it feels like, we didn't even hit a point of education that we needed to hit before we started to, have this regression period. That's really, really, it's painful to see. And it's something that I can very clearly understand and picture for myself, even coming from, besides being a young person, coming from the Black community, where there is a lot of historical medical mistrust, right?
Mm-hmm.
and with well precedented, especially towards entities like the CDC, that ran pretty messed up experiments on Black folks in the 60s and 70s. Our community remembers things like that. So someone from a real professional doctor showing up and saying, take this medication, that's just not going to go over well, or have the same kind of impact, or people might not even understand that the same way, might not understand their personal public health the same way as traditional, folks that receive that kind of care. So fighting misinformation is like a whole other half of the job, for someone who is recently diagnosed as HIV positive. Luckily at Aliveness, we have a lot of systems to really care for new diagnoses. Those folks, even me myself, I don't know everything. Like I wouldn't know what questions I would even want to ask, if I was to transmit HIV. It would be like, where do I begin with this? How is my life going to change? And then you have all the misinformation that's been drilled into you, or lack of information. So you're like, am I going to die? Is there a way for my life to continue? The AIDS line started at, I am going to forget the name of what this organization was called way back in the day when the AIDS line started, but they were known most recently as Rainbow Health. They unfortunately closed last year, and one of Aliveness's top priorities was continue the AIDS line, because that's a hotline that folks call when they receive a new diagnosis, or when they've they think they may have transmitted, or they just have any question about HIV. They call that hotline, and our folks will give them information and get them into care if they need it. So we have some of these structures in place to get folks that education, get them where they need to be. But yeah, it is still a challenge of the fight against HIV in 2025, of pushback against misinformation.
We like to report facts here on the show, and I do want to highlight some facts.
Yeah.
It was a shock when Rainbow Health closed, and y'all at Aliveness Project facts picked up, and really it was just amazing everything that you all are able to do in a very short amount of time to allow for continuity of services, not only for picking up things like the hotline, but even for individual cases of patients who were receiving care from or support resources from Rainbow Health. You all just did an amazing job. #facts. That was just thank you for the work that you all did there. And it is, you're talking about the education component of it. I'm even thinking about the representation in media. It blows my mind. I will say that I can turn on the television and see 2 different ads for Truvada and Descovy. Right. And the only time I saw anything like that when I was a kid was, the death count rates. The idea that you could see 2 people kissing and talking about PrEP just blows my mind. But even when we see films or TV, if it's an HIV storyline, we immediately go, oh, that must be in the 80s then, or early 90s. We see such very little representation of that, even in, today, if there's going to be, nothing of what it's like currently.
Yeah. Yeah. People who are HIV positive can live full and healthy lives,
Yes.
And I'm lucky to know at this point, many queer elders who are HIV positive and living full, happy and healthy lives and just thriving. You know what I'm saying? And you're right. I don't see a whole lot of characters that are like, oh yeah, I'm positive, and that's it. And there's not a whole tragic plot line around them. But media analysis isn't necessarily what people came to hear me yap about. So I shouldn't get too far into it.
I'm obviously I'm in the media, so I'm always tuned in to what are we doing as an industry around this. And maybe if we hadn't waited until cuts of 10,000 individuals and have been reporting on things, that's another episode that we'll dive into.
This whole year, we shouldn't be. I'll just say, for anybody who's struggling in these times, don't beat yourself up over coulda, shoulda, woulda. I think if we knew that this was going to happen, we all would have been moving differently in 2024 and 2023, right? So,
well, if only there'd been someone who'd been telling us what was going to happen. If only there was a document where all this had been written down, where we could have looked at it to see. There wasn't any of that in 2024. All the listeners here are screaming into me. All right, something I do want to start talking about, and I've got 2 minutes before this break, but talking about that, advocacy. So where are areas that folks can support the advocacy work that either Aliveness is doing or other organizations, either at the state level and federal level, I guess, with our representatives, maybe starting there? Like, where can we engage in that?
Definitely. So I had the pleasure of I'll start at the federal level. So I had the pleasure of being in Washington, D.C. for AIDS United last week, which was, we had around 500 what we call ASOs, AIDS service organizations. So organizations that are just like Aliveness in, just nationally around the country. We all came together to lobby our elected officials, meet with each other and have workshops and stuff like that.
Wait, was that in reaction to what just started last week, or that was pre-planned?
That was pre-planned, but like we had our policy priorities well arranged.
There as they're cutting. Oh my gosh.
Yep. So I had a chance to speak to Senator Tina Smith's team, Amy Klobuchar's team, and Ilhan Omar's team, and then we left letters and data for all of our other state legislators at the national level. And I mean, I'll say what they need most right now from us, and this is what we ask them, are like our stories. They need people to be, sending them letters, emailing them, participating in some of these mass campaigns that you've seen going around that, that really are about like, you need to be advocating for protecting the CDC's Division of HIV prevention. Oh yeah, yep, break.
I've got to fit in another break here. We're going to have more with Ezra after this break from the Aliveness Project. Stay tuned. More to come on The Gailey Show. Welcome to The Gailey Show, coming to you from the studios of AM 950 KTNF, the progressive voice of Minnesota. I'm your host, John Parker. It is 33 minutes past the hour. Once a week, we go beyond the headlines with our Thinking Clearly, Thinking Queerly episodes. I sit down with a guest for the episode to help us think more clearly and queerly on the major issues of the day facing the queer and allied community. If you want to stay up to date on the headlines as they're breaking throughout the day, I invite you to stay with us here for the Matt McNeil Show at 3 p.m. here on AM 950 and Native Roots Radio at 5 p.m. My guest is Ezra McNair. Ezra is the advocacy organizer and volunteer manager for the Aliveness Project in Minnesota. Ezra, you were talking about before the break ways that we can be engaged and have advocacy. You were talking about writing and calling in to our legislators to let them know their support for it. Can you pick it up there?
Yeah, of course. So one of the ways that our legislators are asking for people to engage with them are sending them letters of support, getting as many testimonies from people that either work in public health services, because your job and your livelihood will be affected if these national cuts take place, some of which already have. And then, people that are adherents to PrEP, preventative services, and HIV care as well. So really, if you're one of those folks, your voice really, really carries a lot of weight in these conversations. And I mean, I'll say there are certain things that DOJ and the Trump administration are doing that seem like it would be impossible to change their minds. But like you mentioned, John, Trump in his first administration had a plan in place that was working well to end HIV in the United States by 2030. That was something, maybe he was listening to his CDC counterparts more back then, and now maybe he's letting RFK really guide his decision making. However, for us, that like we see an inroad to say, hey, President, this is a program that you started. Why would you cut this without seeing the true benefits and seeing the fruits of this program that you could take credit for? And it would be a thing that people aren't mad at you about, So as much as our legislators are mainly, I think, trying to use that angle to get some of, especially CDC's HIV prevention reinstated, or, they say that a lot of these services that they're cutting from the CDC are being remapped under the umbrella of, the American Health, Healthy America, AFHA or something. Yeah, right. So we can also advocate for that, RFK's new division to continue this work, without the personnel and without the funding. I don't necessarily know how they do that, but that's like one piece of it. That's for the national legislature. And then locally, Aliveness and our partners at Outfront Minnesota and some of our other public health partners have our HIV on the Hill Day on May 5th, 2025. You could go to the Aliveness website and sign up to have a meeting with your legislator and to bring some of these issues to them and talk to them about how it affects your community, how this kind of funding empowers people to live and thrive in their lives. Aliveness does us and our partners will train you on how to have those conversations. You're not going to be having a meeting with your legislator by yourself. We'll have lots of numbers and lots of data for you to relate to them. Kind of like how I'm doing to you now, John, just giving you the lay of the land. But like, that's what legislators need. And then once they have that information, in Minnesota, we're facing a $9 million cut to HIV services. That's coming from our Department of Human Services. There's a budget shortfall, and in the allocations that came out at the beginning of the year, we're going to see a pretty big reduction in local dollars, right? So we have actually, Scott Dibble is authoring a bill in the Senate, and we also have a bill in Congress, on the congressional, in the House half, both to recoup that funding and support it with just a few extra dollars. So we're really hoping that, we don't see any cuts happen immediately in Minnesota. And with some of these bills we have in our legislature this year, we can recoup those dollars and continue to support the HIV community. So we're really pushing on our legislators to support these bills that we have. The deadline for the budget is coming soon. So I can tell you we're at Aliveness biting our nails to hopefully make sure that funding gets in the budget and gets put on. So
right, yeah. And I was reading about how the tariffs and everything that's happening at that level is exacerbating the shortfalls that we're seeing here in the state of Minnesota. So it's not just at the federal level. If I may ask a larger future tense question, something that I have been wrestling with here on this show, and listeners will know this, is the idea that we've seen this play out before. We know how this ends. It all ends badly, the policies that they're going at the federal level. Mm-hmm. Even if we retake Congress in 26, ideally the presidency in 28, there will be very little infrastructure left to deal with issues like HIV prevention. What would be, it's not just going to be enough to go back into the files and pull out all of the position descriptions of the positions that were let go, right? We're going to have to find new ways of funding this work, because the funding will all be gone ostensibly once they get their budget passed and give all the tax cuts to all the trillionaires. What would you see? And I know this is probably a big speculative question here, but as we're being forced to rethink at a federal level and even a state level, what role we want the government to have, which has already been dicey when it comes to HIV over the past 40 years, where would you like to see that go?
Yeah. All right.
Huge questions.
I think about this, keeps me up at night, John. I'm serious. I really consider the impacts of the cuts mean that people will lose their lives, and the amount of HIV cases will go up. And that is super concerning. And right now, HIV, in the 80s and 90s, HIV care and awareness function more like a social movement. The ways that ACT UP and even public health organizations had to advocate and had to represent their communities were just a little more radical. Right now, we've been working with the state so closely for so many years, and we have programs like Ryan White, HHS, and the prevention programs that are so enmeshed into the state structure that it is hard for program staff, nonprofits to figure out how to step into some more radical roles as these next couple of years go on. Part of what was so energizing about meeting so many other public health workers was two things. One was I didn't realize the public health sector, especially in HIV care, was so Black. Last week, I was meeting so many Black queer folks that work in the same role. And in Minnesota, I can feel just a little isolated in my niche here. But we're a community who is used to resistance. We are used to the government not accept it, like, doing the best protest, doing the best advocacy, and the government still saying no. So like we have, we're resilient in that sense of like, we'll think outside of the box. And that's what I would say everybody who is facing Doge cuts, facing the brunt of, I'll say it, facing the brunt of the fascist takeover of the government right now.
Yes.
All of us need to think about like, we're going to have to figure out ways around some of these systems that will prevent people from getting the care that they need to live. Those conversations are really tough to have. And I don't have all the answers of like what that looks like. I shouldn't even make suggestions of what I think that might look like, because I don't want to get into too much speculation, but like that is where a lot of us are thinking. I'll also say I had the pleasure of hearing Congresswoman Maxine Waters speak on this exact topic. And she really put it into perspective for me, because I kind of had all these questions in my head of like, oh, what do we do? What do we do? And she said exactly what you say. Once these systems are gone, there's systems that took 15 years to get in place. So once they're gone, they might not come back, and they might not come back quickly. And in the sense that we need them to like save people's lives tomorrow, they might not be back on that timeline, and that's a sitting congresswoman who's a pioneer of HIV legislation at the federal level. And for me, that really put into perspective of like, yeah, you're right. We need to start thinking of new and different ways to care for people, start developing community systems that are less reliant on the federal government, less reliant on state dollars. So yeah, it's going to be there'll be some times of like, I think, uncertainty, but also I am really, really hopeful that the public health sector is going to keep trying to preserve lives and save lives no matter the cost. Really, to put also, when Rainbow Health shut down last year, there were folks from Rainbow Health that were like, I need to keep meeting with my clients, whether y'all let me or not, like I need to keep supporting people. How can I do that? Can I work with Aliveness to do that? I've seen that dedication from the public health sector before. So I know that whether people are getting paid a paycheck or whatever, people are willing to do the work to save lives. And like, that's really what we need, Yeah.
The intersectionality that you're bringing up there, like the conversations I want to have about an intersectional Medicare for all or comprehensive, healthcare. If you're going to get rid of it, we're going to come back with something bigger and better, because we have to. I mean, that's the thing. We're being forced to be radical, whether we want to or not right now. Something less speculative and something that folks can do right away, which is one of my favorite things to do, which is eat. Dining Out for Life is coming out this month, correct?
Yeah. So on April 24th, this is a classic national event that Aliveness participates in. But on April 24th in Minnesota, across the whole entire state, there's around 115 restaurants that are signed up to participate in Dining Out for Life. That day, they will give part of their proceeds back to the Aliveness Project. So all you have to do is go out to eat at one of our participating restaurants, smile and enjoy yourself, because part of your check is going back to supporting people with HIV. And exactly like we're talking about in these times, we need different structures of funding. So, a nice, chill, fun fundraiser like that is definitely one of the ways, at Aliveness, one of our biggest fundraisers. So it's definitely a way that people can, directly support the community. All of the funds that we raise during Dining Out for Life goes back into our food program at Aliveness, which is a free food program, So you hear people complaining about like, oh, I'm running a restaurant and it's hard to make money. Just imagine a nonprofit free food program, So like, it is definitely something that we need to continue support for. And I'm glad that Dining Out for Life provides a way for people to do that. So yeah, April 24th. Mark your calendars.
How do folks, it's been on my calendar. How do folks find the restaurants? So do they go to your website? Are there how do folks, social media that they can find out where they can go to dine out?
There is a wonderful website called diningoutforlife.mn.com. You can go there, type in your zip code, and it'll show you all the restaurants that are close to you that you can get to, or it'll show you the full list. So if there's some place that you're really angling to try, make sure to go try it on the 24th. That's a perfect day to do that. Invite your friends out, take someone special on a date, anything you want to do to make the day even more special than it already is, we heavily encourage. Yeah.
Yes, and I communicate about it for listeners who are now putting it on their calendars. Make sure you communicate that and show folks that you are doing this.
Yep.
Because again, I love that we had 25,000 people that were on the in front of the Capitol last Saturday, but I also want to see them at the caucuses. I also want to see them at Dining Out for Life. I want to see that wasn't enough. There are so many other areas that are low entry, not a lot that you need to do, but have such a huge impact. And Dining Out for Life is definitely one of them, and for sure the tastiest. Ezra, how else can folks connect with you and the Aliveness Project once they get done listening to this episode?
Yeah. So if you go to the Aliveness Project's website, that is just aliveness.org. There's a wonderful section on there called the Advocacy Center. You can click on the Advocacy Center, and there's going to be 3 actions that you can take today to either send letters to your legislator or sign up for our lobby day on May 5th, which is another really, really key day. We're trying to get as many people to have meetings with their legislators as possible to really give them that final push that they'll need when that vote comes around to approve HIV funding in Minnesota. So they definitely need to know, your story, you're important. And please show up, speak to your legislators. So that's aliveness.org, Advocacy Center. You'll be able to see all the different ways that you can get involved.
Perfect. Ezra, this has been such a delight. You are officially a friend of the show. I want to have you back on to continue the conversation. So thank you for being here with me today.
Yeah, thank you so much, John. It's an honor.
We're going to include links to all of this in our show notes. You can go to our website and find them. For right now, we are going to come back. Stay tuned. More to come on The Gailey Show. Welcome back to The Gailey Show. I am your host, John Parker. Every week, I close out our Thinking Queerly episodes with a weekly essay series. Wow, it's the end of the week. Can you tell I can't talk anymore? A weekly essay series called A Queer in the Cosmos, an opportunity to understand queer life through the exploration of the cosmos. Here is my latest essay, Lightyear 9, moving on down, down, down. You've probably played a version of the following game, most likely as a kid, or while getting high in college, or after watching films like Inception, The Matrix, or even The Truman Show, or Free Guy, or if you have especially good dope. And it goes like this. What if we're just a reality TV show for aliens? What if we're just somebody else's thoughts? What if the world was actually an AI simulation and we're just plugged into it? Worse, what if we are AI in someone else's really stupid video game? What if the universe was just a marble or the sparkling eye of a unicorn? Of course, some folks actually have found a way to get paid to ask questions like this, or they pay others for the opportunity to ask questions like this in college. There are whole philosophy books about pantheism, the philosophical argument that we are just God's thoughts, and idealism, the philosophical argument that all reality is made up in our own heads and nothing exists outside of it. Simulation theory, again with the computer programming. Modal realism, the philosophical argument that everything that could possibly exist does into infinity. And solipsism, the philosophical argument that you are the only person who exists, no other consciousness does. You created all of this, which means all of the world is going to hell because of you. Not a big fan of that one. As a game, it was fun to play while getting high and rummaging around for snacks. It was a fun thought experiment after a movie, though seemingly a time-limited one. It never seemed quite as fun the day after. As I was not trying to be a philosopher or pay tuition to study to become one, I didn't have much use for pantheism, idealism, simulation theory, modal realism, solipsism, and others. None of those accounted for getting through my day as a queer person, avoiding getting, gay bash, or finding just a place to be gay in, or find a relationship to be happily gay in, or to stop straight people from being obsessed with everything I did and trying to pass laws to regulate it. Let me rephrase that. When I say I didn't have much use for, what I mean is that the idea that the life I've been made to endure is nothing more than a thought of God or dictated by a computer programmer, or the result of my own consciousness, since I'm the only one who engages me to the point of not being able to think. If this reality is but one of all the possible infinite realities, I suffer an enraged jealousy that I'm stuck here, and there is another John who got all of the things I not only wanted, but needed. The various ethics courses were the philosophy courses I could handle as a rational student without bubbling, grumbling, and spewing like a volcano. But after recently returning from Sagittarius A-star in my writing of this series, the internet algorithms handed me something that I thought, oh, why not? Let's write about it. Though what I'm about to write is actually based in scientific fact. As a reminder, Sagittarius A-star is the black hole around which the Milky Way spins. Data from the James Webb Telescope, a $10 billion venture that began its cosmic observations in space in 2022, provides us with evidence of an argument made in black hole cosmology. Everything we see on Earth, in the solar system, in the Milky Way, in the observable universe, in the unobservable universe, is all sealed within a black hole. Black hole cosmology is the brainchild of theoretical physicist Raj Kumar Pathria and mathematician I.J. Good. Polish theoretical physicist Nikodem Pawlowski has run with it in his own career, elucidating and adding to it. We start from what we know. Black holes begin when a star collapses. Nearby matter is sucked into it and compressed into a tiny space of infinite proportions. If this process were to happen to Earth, everything on Earth would be packed down into something the size of a ping pong ball. Okay, so far so good. We also start from what we know about the Big Bang, from an infinitesimally small point of matter that expanded through the theory of inflation. Not that inflation, the good kind, a super fast expansion of space, as in super fast, as in exponential growth in milliseconds fast. We have the universe we see today that, despite inflation stopping, is still expanding. Enter black hole cosmology. Briefly, because I have mere minutes, my own inflation to share this with you. The black hole starts as usual, but as it's compressing everything down, a force called torsion starts up, and it prevents the black hole from compressing all that matter down into an infinitesimal point. The result of this pushback would be a lot of intense gravity that starts creating particles left, right, and center. These particles would start spinning, creating more torsion. Eventually, the amount of space-time torsion would be so great, it would cause a big bounce. Think of a beach ball blowing up. This would cause all stars and black holes in our universe, as they got started, to rotate as we observe them. And they would rotate in the direction of our parent black hole, which is what the James Webb Telescope is showing us. After examining 263 galaxies, 2/3 of them are spinning in the same direction. Only a third, for reasons to be determined, are spinning in the opposite direction. The spinning is important because if there was only the Big Bang, without us being in a black hole and all of its torsion, then we would expect an equal number of galaxies rotating in either direction, clockwise, counterclockwise. We would not expect 66% of them to be spinning in the same direction. This would also mean that in all of the black holes, including our very own Sagittarius A-star, there could be an entirely other universe. But that's for a different essay. Thank you all for being here with me today on Thinking Clearly, Thinking Queerly. Be sure to go to our website, ami50radio.com, or if you're on YouTube or you're listening on Apple Podcasts, Spotify, look in the show notes. You can find the links to all of the stuff that we talked about here today with Ezra and the Aliveness Project and Dining Out for Life. Please stay tuned for the Matt McNeil Show, which is coming up next. After that, Native Roots Radio at 5 p.m. Until tomorrow at 2 p.m., keep it queer, America.